We need to listen to women. We need to hear what they're saying. We need to stop having a woman come into the ER who feels heart palpitations and be like, you're good. You're just getting old. We got to stop doing that. I don't know why we're so dismissive of women and women's health. I mean, 8% of the NIH budget is women's health. Like, we're 50% of the population. Why are we 8%? Like, why is testosterone only for men? Like, we have testosterone. Why do we only get FDA approval for men? And we have to empower the patients to demand the care they deserve.
Well, welcome back, everyone, to another episode of Healthy Rebel Speaks Out. And I am your host, Bonni London, and it is the intention here to give you the tools to take ownership over your own health. And today we are talking about something that nobody may have prepared you for: the fatigue that coffee even cannot touch, anxiety that just comes out of nowhere, night sweats, brain fog, and feeling like basically your entire body has been hijacked. You are not losing it. You are in perimenopause and you deserve answers. And here is what the research shows. Over 80% of women report hot flashes, night sweats, crushing fatigue, anxiety, and depression during menopause. But here's the kicker. For more than half of women in their early 30s, it has already started. 55% of women aged 30 to 50 are dealing with moderate to severe symptoms right now. And we have been told for too long that this is something we're going to have to live with. Well, today I am telling you that those days are over. And I am so excited to introduce today's guest. Her name is Dr. Jennifer Rowlands, founder of Precision Health MD, and she is a board-certified OBGYN and functional medicine doctor who's making her life work helping women stop suffering and helping to lead their health. And what is her philosophy? You're not a patient, you're a SHIO. You are the CEO of your own body, and it's time to take action. So let's go. Well, welcome, Dr. Jennifer Rowlands. I am so grateful for you to here today and just shed light on things that so many people struggle with, specifically during perimenopause, which honestly, I have to say, I feel like I never even heard that word up until recently. Is that true?
Yeah, well, thank you very much for having me. And it's gained a lot of popularity recently with, celebrities that are my age and your age that are starting to say, forget this. So we're getting a little bit more knowledge nowadays online with perimenopause and menopause in general.
Do you think that people have had these symptoms or they're getting worse? Do you think this decade is worse? I mean, I'm just wondering, was this always around, or have things changed in our environment is my question.
Well, perimenopause has always been a thing. It's the transition leading up to menopause. So typically it's 4 to 10 years prior to menopause. And menopause is, 1 full year without your period. So this has been around. I don't think people recognize this as a stage. I think in medicine, we've always sort of said, okay, you're either premenopausal or in menopause. That's it. There's no in between. And
Right.
so now we're starting to understand, and not that the science wasn't there, it's always been there, but we're starting to recognize that women are going through these symptoms and are being affected by their quality of life because of perimenopause, and that we have the tools to do something about it. We don't have to wait until they go through 1 full year of no periods to start them on anything, really.
And this is crazy. So just so you know, I tried to do a little prep for our meeting today just on the most recent statistics. And basically more than 80% of women are having hot flashes, anxiety, brain fog, all of these symptoms during menopause. And they're still walking around feeling like they need to live with it. That is just part of this, or maybe they're blaming it on other things, right? I mean, I think that can happen too, because it can be a very stressful time in people's lives where they're raising small children, maybe working full time. I mean, right?
Yeah, a lot of women are in a sandwich generation. They're taking care of parents that are aging, and they're also have their own children to take care of. And so the stress and the burden is huge on them to try to, you're always the last one that you take care of, right? When you're worried about your kids and your mom. And so yes, you're right. 80% of women experience symptoms that affect their life. And it could be hot flashes, it could be depression, anxiety, it could be can't sleep, could be rage. Like there's a lot of symptoms. There's over 80 symptoms associated with perimenopause and menopause. So, but 80% of women will have symptoms that
I
affect their life.
just want to repeat that again for everyone. 80 symptoms.
Yes.
Really, we need to send a link for the list of those 80 symptoms because, again, like so many things as a medical practitioner, you appreciate that it can be associated with so many different things. And so then at this point, okay, I have a couple of these things, anxiety, gained a little weight. I don't know. At what point do you think someone should like get their hormones tested, and what do you recommend?
Yeah, so testing hormones is a little bit controversial because the guidelines essentially say you don't need to test someone's hormones. And the reason why they're like that is in perimenopause, it's like a roller coaster. Sometimes your estrogen is high, sometimes it's normal, sometimes it's low. It's this roller coaster going on the way down. And so it can be very difficult to test someone's hormones unless you pay attention to the day you test them, right? You have to be knowledgeable enough about a menstrual cycle to know estradiol level is very different on day 3 than it is on day 21. So you have to be able to do it and be knowledgeable to test it. For women but you don't have to test them if you want to start, say, hormone replacement therapy. Someone who is symptomatic, who's in perimenopause, does not have to be held back because of blood work. So I see patients who sometimes want to test their hormones because they want to know where they're at and they want to see kind of where they are as far as what's their estrogen, testosterone, and progesterone level. And other women who are like, you know what, I got to start sleeping. You got to give me something because I need to sleep because my brain is not functioning because I'm waking up at 3 o'clock in the morning every single night. So it doesn't have to be testing, but if you're going to test, you really want to know what day of the cycle you're actually testing on.
Okay, and how does people are waiting longer and longer these days to have children? So how does this impact this entire hormonal thing, right? I mean, it seems like it obviously would make it more challenging.
Yeah, there's if you follow any of these celebrities online, Naomi Watts, her story is that she was 36 and decided to then start having children and realizing she missed the boat, that she was actually experiencing perimenopause symptoms and pretty much went through premature ovarian failure or early menopause. And then she was not able to have children because of that. So it does complicate the matter when you're starting to experience these symptoms and you're in your late 30s or even early 40s, that you may not have the same fertility you thought you might have in those aspects. That's happened. I've seen several patients like that where they waited till they were 42 and then they go, oh no, like I'm not able to anymore without assistance, or I just can't in general. So again, it doesn't for testing wise, you just really need to know where they are. Day 3 estrogen is very different than day 21 estrogen. So if someone's starting to have irregular cycles because they're in perimenopause, they could still have testing if you wanted to. You just need to make sure you have the days dialed in specifically for that. But again, I don't make people have to go through testing if they're symptomatic and they want to do something about it from an HRT perspective or non-HRT perspective. Let's do it. Let's work on it, right? Let's get you feeling better and feeling more like yourself and not have to hold back if you need to.
Now, this is great, and I'm wondering your opinion of the recent like kind of turnaround of opinion from the FDA, just about their viewpoint, just in general, of giving people, women, exogenous hormones over the last 20 plus years.
Yeah, so in early 2000, in fact, 2002, the Women's Health Initiative study came out, which said that hormone replacement therapy causes breast cancer, a blood clot, or stroke. And so the prescription rate was about 70% of women who were candidates for hormone replacement were on hormone replacement. And immediately the rate went down to about 4%. And over the last 20 years, it's been 4, 5, 6% of women are on HRT who are candidates. And because of the Women's Health Initiative study, at the time, the FDA put a black box warning on all estrogen. It could be vaginal, it could be systemic, meaning the whole body senses that estrogen. And so they kind of like black boxed all of it, right? But vaginal estrogen is not systemic estrogen. So you can use vaginal estrogen and your whole body is not sensing estrogen. It doesn't affect your estrogen levels or estradiol levels. So there are people that are advocating to say, don't put them all in the same bucket. It's unfair. Vaginal estrogen is safe for most women. It's safe for breast cancer patients. It's safe for women who had blood clots. Like, it's not the same beast. So they're fighting to get that label, the black box, taken off, because it does scare doctors from prescribing it. It also scares patients. You know, they get the prescription from their doctor, they come home and read that big old pamphlet and go, oh my God, I'm not going to take this because it says I'm going to get cancer. So the study that was done back then has now been analyzed and overanalyzed and redone, and there was serious flaws with that study.
Mhm.
At the time, the study showed that estrogen, again, the headline in Oprah, right? The headline in today's show is you're going to get breast cancer. But the estrogen only arm actually did better than the people on placebo. The
Right.
estrogen only arm had a protective effect.
And also, can you speak to the kind of estrogen they were given, which was the big one is Premarin?
Yeah, so the type of estrogen they were given was a horse urine, made from horse urine. We don't even use that anymore. So we know from,
I have a client I just got to mention who's in her 80s who still is on Premarin.
yeah, and you know, working for 30 years, it's okay. You know what I mean? We'll keep you on it. We're not going to disrupt the apple cart because of that. But what we do know is those metabolites of that particular estrogen are more thrombotic, meaning you have a higher risk of having a blood clot from that particular type of synthetic estrogen called conjugated equine estrogen. So we don't use it very much anymore because, again, we have safer versions of patch and we don't, and creams, and we don't need to use it. Do you know what I mean?
Sure. And right, it goes through the liver. Like I understand the whole metabolism is completely different.
Completely different.
Right. So
Yeah. So we
just so
don't use
I
it.
know for myself and anyone else who's interested, I'm okay to put estrogen cream on my face because it's compounded now in skincare.
Yeah, yeah,
I think,
yeah.
what the heck, why not?
I love it. I use it too. I use the version that has estriol with copper peptides and hyaluronic acid because I want to retain moisture. I want to fix the tissue, and I want
Okay.
the food for the skin. So I use the copper peptide one. So that's the one I like because I did an actual YouTube video on that one too, which was
Oh,
about
I love
neck
it.
estrogen. Yeah, because I mean, why not? Like, I want to get rid of this creepy neck thing.
Oh, please, just wait. Okay, well, um, now this is personal too, but I have a question about just your thoughts about, I mean, PCOS, there's multiple different kinds of PCOS. And I guess my question is about birth control pills. What happens in menopause to women that have been diagnosed with PCOS?
Yeah, I would love if there was a study on PCOS women going through perimenopause and menopause. There isn't enough clinical data for me to say, oh, they have this or they have that. But my personal feeling is that they already have an insulin resistance issue. Perimenopause makes insulin resistance worse. So here you are, sort of like a setup. You're already in that category of having an insulin resistance issue. Now you go through perimenopause, which does not help your insulin resistance problem, and then sets you up for cardiovascular disease later on, diabetes, all the chronic conditions. The other thing is that we know PCOS patients in general have this hormonal imbalance, right? And so you can imagine that they already have a difficult time with trying to get the ratios of estrogen, testosterone, progesterone in good quantities, hence why we put them on a birth control pill, because we're trying to give them those hormones. We're like, it doesn't matter what your cycle wants to do, here's estrogen and progesterone. Every day should be exactly the same. Like, it should be Groundhog's Day every single day. But those women who are not on birth control pill as they go through perimenopause start having more issues related to those lack of progesterone, higher levels of estrogen. So they start having their like baseline PCOS problem now complicating the perimenopause picture. I think more women that are younger, I see a lot more women that are younger that are not happy with the option of a birth control pill because they realize even though they're controlling estrogen and progesterone, they're not controlling any of the other hormones that PCOS causes problems. It has nothing to do with insulin, has nothing to do with ghrelin, has nothing to do with their serotonin. Like, so we're not fixing the other aspects of PCOS with just a birth control pill. So a lot of the younger generation, I think, are really savvy and are much more knowledgeable about it being a metabolic problem and wanting to address it from those other aspects Now they may need the pill because they need birth control, but they're not just settling with just the pill. They're saying, okay, what do I do about checking my insulin resistance? What do I do about
Yeah.
checking my cholesterol? What do I do about checking my vitamin D? Vitamin D deficiency is very common in PCOS patients. So I think, I don't say no to a pill if patients want it. I try to make sure they know that even if they're using birth control for birth control's sake, you still have other things you need to address with the PCOS lifestyle.
Well, this is fantastic. And just again, on a personal note, having had PCOS, but I didn't, basically what happened, which I think still happens now, is that, I didn't get a regular period. I was 18 years old and they just put me on birth control. But what happened was on the back end, when I wanted to get pregnant about 10 years later, I had the whole, I'm sure you're familiar with, it's not like an actual diagnosis, but like post birth control syndrome, and had
Mm-hmm.
major like fertility problems and all of that. And again, like you said, I think it has its place, a birth control pill, but I think that patients have a right to know what is causing their irregular periods. Could there be a contribution from their diet, or we know like iron, for example. I mean, to me that's what was like the missing piece, bigger than anything, like you said. So I love that this is like a shift, and maybe patients taking a little more, well, and doctors, obviously, like yourself, maybe not everyone, but educating them too.
Yeah, yeah. I spend a lot of time with women with PCOS so they understand their health now, but what's kind of coming down the pike, right? Like, what do you think's because if you look at it as more of a whole body problem or more systems, you're going to sort of be more proactive to go, okay, yeah, every year I want my doctor to check my fasting insulin. I want them to check my vitamin D. I want them to check my iron panel. I want them to check my testosterone. Like, you're going to be more proactive to say I got to look at how I live in my 20s is going to really affect how I am in my 40s. And the more I look at that from that lens, the better it's going to be when I get to my 40s and not feel like the wheels are falling off. You know what I mean?
Yes, and you make me think of a very, very important point too, that I think young people don't think about, is bone health and how important these hormones, if we're not in sync there. And right now, well, you can tell me like the latest uh, recommendation, that you don't get it until your menopause to get your first DEXA scan. But I mean, but why that is a tragedy, I can see you are in agreement with me.
Yes, I think that's one of the things that just really is wrong in women's health. Why we wait until someone's 65 to check their bones is completely stupid to me. I mean, US Preventative Task Force decided that they wanted to, it's a cost thing, right? How many people are we going to pick up with fractures or potentially in osteoporosis to the cost of getting a DEXA scan, which by the way is about 50, $75. Like it's pretty inexpensive. But
Right.
that's how medicine works. So to me, if the average person goes to menopause at 51, you basically have 14 years without any hormones or 14 years exposure. Then you're testing them for bone loss. That makes no sense to me whatsoever. In my mind, the biggest decline and in perimenopause, you lose bone mass and you lose muscle at a very accelerated rate. Why we don't check them in perimenopause, I don't get it. It should really be done. And so I recommend to all my patients to get their bone scan done in their, perimenopause phase, if that's mid 40s or late 40s, to see where you are. In fact, mine, I'm 48 years old. I was an avid marathon runner. I ran cross country, track, swimming. Like I never sat still. I've run 4 marathons, about 20 half marathons, and I have osteopenia at 48. Doesn't make any sense whatsoever, right? Like, how does this person who's basically been a lifelong athlete have osteopenia? But I do think some of the stuff that's starting to come out too about chronic birth control usage and the lack of hormones being so suppressed for your whole life. And what does that do for bone health? I think that the research needs to go that direction to see what is it, because there are some studies that indicate maybe someone who's been on a birth control pill for 25 years might have a higher incidence of bone issues because you didn't have the maximum amount of estrogen you could have had in your lifetime. So I think it's a disservice to wait till someone's 65. I say mid to late 40s, get your DEXA scan and go from there. If it's completely normal, great, you can wait for a while.
Thank you.
But if
And
it's not,
yeah.
let's get a plan.
And I would add back to the PCOS, because these are the people, because I also didn't get tested until recently and found out I'm basically almost osteoporosis at this point. But you know, when you're at PCOS, you're lacking all those important hormones for years and years and years during that critical time. And so, yeah, I think this is such important information to get out there. And then I think about you, which I'm very impressed with, 4 pregnancies.
Three
Well,
pregnancies because I had twins.
oh, I don't know if I remember that. Well, I have twins, so I had 1 pregnancy, but I'm just thinking about bone health and all of this and how this impacts it too, right? I mean, that must have impacted you because,
Yeah.
you
Oh
know,
God. Pregnancies impact a lot of stuff. Your vascular, your blood
and
vessels, your brain, your body, your
I
cortisol.
know, nothing is ever the same down there. Okay, let's just,
Nothing is ever the same down there. That is true. That is very true. Yes.
but, but it's awesome. And how old are your kids?
I have an 18-year-old, 15-year-old, and two 14s. So I have four teenagers.
Oh my God.
Yes.
Wow, you are one impressive woman. A lot of hormones going on.
Shocking.
A lot of hormones there. Yeah, but there is no question that I think even though this has been part of nature, obviously for millions of years, I think, I mean, we know like autoimmune, like a lot of things can happen after people go through pregnancies because it is a real stressful time for a woman. And then thinking about them having it later, and our topic today of perimenopause, we have like the perfect storm.
Yeah, pregnancy is a wonderful test for a lot of things. I mean, the risks of, blood clots, cardiovascular disease, diabetes, all these things, pregnancy is an ultimate test for that because you're testing these, people develop gestational diabetes and then they're set up for later on having diabetes. They develop preeclampsia. We know that those people have a much higher rate of high blood pressure later on. Like there's this sort of like physiological test for a woman when they're pregnant because it kind of tests their system to see how are these things going to go later on as you age. And we do know that from lots of good guidelines that say, if you have, like, again, gestational diabetes, you're likely to have diabetes, 50% chance. So there's a lot of sort of tests for those things. But yeah, perimenopause, I would say, would be the next test is here you are with all these pivotal hormones that are going down. And because estrogen receptors are on every single cell in your body, then all these things become like a domino effect. So it's not just about hot flashes, it's about your vessels change, your blood vessels being more squeezed. You may develop hypertension. It's about lack of cholesterol. So then you hold on to cholesterol and then you get high cholesterol. It's about you have immune system dysregulation. Women develop autoimmune diseases in perimenopause because their immune system is not being bossed around by estrogen anymore. So there's so many systems that are sort of like a domino when we lose those hormones. So you can imagine it's like another test to the system, right? Of how is this going to be for the next 30 years?
It's crazy. Well, I'm really focused on gut health in my practice, and there's something called I might not be pronouncing it right, but the estrobiome, basically. But how the estrogen, has this like protective impact on the whole like ecosystem of bacteria in the gut. And it really is like the perfect storm. And I work with a lot of women later who they don't know how they got the belly fat, basically, which can happen in perimenopause too. But it's not their imagination. Like there's a lot of I say it's like the perfect storm.
Yeah. Yeah.
That
And
is
gut health is very, very important. Gut health, we metabolize estrogen in the gut. It's part of, we have liver and then the gut that gets rid of it. So it's the estrobolome, this specialized microbiome that's in the gut that has to do with estrogen regulation. So women start going through perimenopause and they go, God, why am I bloating now? Why am I gaining weight? Why am I PMSing like on steroids? Like what's going on with my gut during this time? Even women can experience things that we call the period flu, where they start having these kind of like, feels like the flu right before their period, because they're again having histamine release during that time because of progesterone going down. So there's a lot of these sort of get accentuated during that time frame. And the gut, if I can give hormones to people all day long, but I'm always like, if you don't have a good gut, forget about it. Like it's not going to, like, this is not going to work. It's the Dr. Carrie Jones is an awesome educator online. And I love her analogy when she talks about the bathtub analogy. Like if you have the shower head that's broken and the drain, who cares about the shower head? Fix the drain. Like, we can fix the shower head, but we got to get the drain working. Otherwise, it's useless. Like, the shower is totally useless.
Right. If you're not metabolizing, because there's several kinds of estrogen, and some are beneficial and protective, and others are not. And so we're relying on the gut to metabolize it. And there's a marker like test for, I'm sure you're familiar with, the beta glucuronidase. That's a gut test. So if it can be potentially that you're recirculating, and this is particularly dangerous, getting after menopause and with, estrogen and everything else, right?
Yep. It's important not only for estrogen metabolism, but also, serotonin resides in our gut, the production of serotonin for our hormone, our happiness, our anxiety, our depression, our mood. So it's very much tied, the gut health, to your mood. And speaking of PCOS women, there's actually is a clinical trial looking at PCOS women and the type of bacteria being different in their gut than other women. The lack of bifidobacterium species, they have a different species organization, which kind of makes a little bit of sense as to why they have so many hormone imbalance issues, right? Like, it's not just about production, but it's also about metabolism. So there's gut is incredibly important for multiple aspects of women's health.
Oh, yeah. And then what about those migraines? Because that seems to be like the biggest thing, I'm sure. I don't know about you, that people will come in and tell me about that has happened with women and hormones. So maybe you can speak to that a bit. Well, it's a pain point. I would say belly fat might be bigger, to be honest. But then after belly fat, I'm going to put migraines in there as like the second kind of biggest issue that women are dealing with.
Yeah, I would say in my practice for perimenopause symptoms, the most common would be sleep. People say, I cannot sleep. I can't stay asleep. I'm waking up at 3 o'clock in the morning, 4 o'clock in the morning. Sleep is a big aspect. Mood. Why do I hate everybody all of a sudden? I felt that way too. I've noticed sometimes I'm like, God, I don't even like my husband breathing. Like, why is he breathing so loud? He's like, what am I supposed to do? Not breathe? Like, what do you want me to do? Like, mood can be very much that rage that happens. Migraines are pretty common. Anxiety, depression, migraines, all neuroinflammation from the changes of hormones that happen. And then people have low libido. That's a common symptom. They're like, I just don't care, could care less. And sometimes that's related to symptoms like vaginal dryness, or, you gain some weight. That's some women don't want to have sex because they've gained weight and they don't like their body the way it looks anymore. But weight gain for sure is up there too. I think there's so many. That's the interesting thing, is that it hits people very differently, because again, if you have a hormone receptor in every single cell in the body, we're not going to have the same experience. I might have different perimenopause symptoms than you have. So it's important that if you're at that point when you're like, gosh, I got to do something because this is not me, then you find a provider that understands the nuances of perimenopause and menopause.
Okay. So someone comes to see you with these typical issues. Where do you start? What is your first, how do you work with people?
Yeah, so I talk to them about, well, we kind of start first education, like, do you understand that these are likely the symptoms that are caused by estrogen lacking, progesterone lacking, testosterone lacking? What stage are you in? Are you in perimenopause? Are you in menopause? Where are you exactly? And then I try to explain too the like, again, it affects the whole body. This may be, you may not think about it. You've now developed, for example, dental problems, and you don't know why this is happening at 50. Like, it may be related to your hormones changing. So we try to sort of get the bigger picture of how this affects your whole body.
It can affect your teeth, your gums and teeth.
Yeah.
Really? Who knew?
Yeah.
I didn't know
Yeah.
that.
Yeah, and people, I mean, some of the things that people find unusual, like ringing in the ears, itchiness, urgency symptoms in the bladder. Like, there's some unusual ones that people don't think about associated.
Electricity. One of my clients has, like, basically gets electric shocks, and apparently that's like a menopausal symptom, which I thought was very interesting.
Yeah, there's all kinds of, again, we
Right.
that list of symptoms. And then I usually try to understand, where is that person coming from? Because I do integrative medicine, I have patients who don't want Western medicine options. They're not interested in that. They're interested in dialing nutrition and lifestyle.
Yeah. So explain from your view, how you practice. What does integrative medicine mean for people who may not be familiar with just, the concept?
Yeah, so traditional medicine and then alternative medicine, integrative is putting those two together. So I think of it as like having multiple buckets, right? So there might be a patient who might come to me for perimenopause who's like, I just want you to show me how to eat, how to exercise. What do I need to do to get rid of these symptoms from a more holistic perspective? Or they might say, I'm okay with supplements and herbs. I want to add that to my treatment plan. Or someone might say, give me the hormones. Give me anything you got, doc. Like, so they could be in any of those sorts of categories. And so understanding where someone's like moral compass leads, where they feel is the right choice, is important for me to know where we're starting from, because then we can have conversations about what makes sense for you, what treatment plans make sense for you.
But right, but in this modern era, because this are discussions that I am having so frequently. I mean, I guess just my opinion and the research too. I think it is very difficult to hit everything just with the healthiest of diet and lifestyle. And like I just had someone today I was talking to. I mean, the rates of young women in their 40s and 50s that you wouldn't consider that are all getting diagnosed with cancer. And to me, it's absolutely the toxins, unfortunately. I mean, what else can it be? Our genes have not changed that dramatically, and it's heartbreaking. And, our country is a little different than other countries in how they allow all of the pesticides as just one example of things that are allowed in our food. I don't
Yeah.
know. I mean, it's just, I feel that supplements right now to me are just like an essential thing for pretty much every person.
Yeah, I think most women need them because, well, I mean, even if you're really dialed in, it takes work. And a lot of women have, you know, responsibilities at work, responsibilities with kids, responsible with aging parents. I mean, I feel like I'm a pretty healthy eater and I mean, I'm those weird people that eats like, my dinner for breakfast. Like I don't like,
I love that.
yeah, I eat a lot of that kind of stuff. But I struggle to get fiber. Fiber to me is like, I got to supplement it because am I in there at 6 in the morning thinking about the nuts and seeds I'm going to throw on top of my dinner from last night? Usually not. Usually I'm like, throw it in there. Let's go, Rollins. So I think those are sometimes you need supplements because you just can't seem to get it consistently. So supplements to me are like, where's the deficits that you can't get, or even
Yeah,
like,
absolutely.
right? Like maybe someone doesn't eat fish, and so fish oil is a hard one to get. So they may do it from a supplement perspective. So I think I believe it's harder and harder to do it just straight without a supplement. But again, everybody's individual. I certainly have had
Sure.
patients in my years that, man, they were like on it. They were
Yeah, it's
dialed in,
just
they were on it.
it is hard. I mean, they're studying this woman recently. I'm sure you've heard who is like the oldest living person. She was 117 years old. And
Uh-huh.
they joke that her LDL was elevated and she ate a lot of eggs, but she was 117.
Yeah.
She also ate a lot of yogurt, but she lived like in the hills of Italy or something. It was just very different. That's all I'm going to say.
Yeah, well, there's studies already with the centenarian studies that talk about those particular, what are the people who live over 100, what are they doing differently than the rest of us, right? So centenarian studies, there's multiple across the multiple locations in the world,
Yeah.
and they have very different diets.
Yes,
Like they
that's what
have very
it's
different,
very
some of them
interesting.
smoke like crazy. Like some of them drink like
Okay.
Sardinia, a lot of those people drink wine for breakfast and they go out and farm all day and then they drink wine when they come home. Like, so very different lifestyles than, say, in Loma Linda, where they're mostly vegan and they don't use alcohol. Like, that's another blue zone area. So they have very different lifestyles, but there's some central key themes that go across them. One is those people move their body, they move every single day. They're not sitting, they're not watching CNN. They're like moving, moving, moving. They have a community. They have a sense of purpose. They have a longing to live, like a longing to a purpose. There was a really, if you've ever seen the Blue Zones movie or
Yes.
documentary, the wonderful gentleman who's like, yeah, like my church needs me. Like I am 104 and I get up every day because they need me. I am
Yeah.
valuable. And that's incredibly important for people to know.
It's huge. Yeah,
Yeah.
I think that's the biggest thing. I mean, I hate to say it as a dietitian, but in the research, social connection trumps everything. And I mean, so whenever I've had the honor to meet multiple people who actually have come to me in my practice that are near 100,
Yeah.
and always want to question them and all of that. So, but getting back to the perimenopause women who
Hmm.
I think are in a very different time in their life, but I think that social part, I mean, I just think it's very hard because again, many of them are struggling between, like you, having teenagers, maybe aging parents, and then we got this whole hormonal flux there. So someone comes to see with all these complaints, and you see where they're at, and then you'll either do diet, lifestyle. Do you do any testing at all, like just a regular blood chemistry or anything else?
Yeah, yeah. Well, most of the time, women have gotten their yearly blood work, right? They've gotten their blood count, their chemistry, their thyroid panel, like the typical Western
The
medicine
basic
questionnaire.
stuff, yeah.
Yeah.
Mhm.
But I think that's not enough. So I look at CRP for inflammation. I look at iron panel. Women are typically iron deficient if they're having heavy periods because of perimenopause. I look at vitamin D because vitamin D, there's a lot of good data now looking at vitamin D and prevention of like breast cancer, colon cancer. So keeping your vitamin D level up. I will
And what do you
sometimes,
think that level is? Because I've heard different things about what the numbers should be at this point.
so a minimum of 40. So a
Okay.
minimum, most of us like 60 to 80 in our world, but a minimum of 40. And if you look at the Quest or whatever, it'll say 18. So it's
Oh my goodness.
nowhere near there. So yeah, you want to be much higher than that. And immune system regulation anyway, vitamin D is great. So I will do that. I'll actually even look at, so if they're having weight gain, we'll do fasting insulin. We'll look at metabolic markers. I like a more extended lipid panel called a cardio IQ because I want to know what's their ApoB and LPA for their cardiovascular risk. So I do a more bigger
Thyroid.
picture.
What
Yeah.
about thyroid panel? Because this is another condition many women. I mean,
Yes.
Hashimoto's, which is an autoimmune, which is like the biggest, cause of hypothyroid, just for people who are listening. Uh, so I've seen it a lot. So I do actually like a full thyroid panel with the antibodies because
Yes.
so many people are undiagnosed. It's incredible.
Yes, I do too. But some people have already gotten that from their standard Western practice too. So it just depends on what is overlapped and what's not. But yes, I always do a full thyroid panel with T4, free T3, and thyroid antibodies.
Yeah, no, I think that's great because again, you see how this can be complicated. It's not.
Mhm.
I mean, estrogen is important. Let's agree on that, but there can be other things going on.
Oh, for sure. You should always rule out other things before just saying it's always perimenopause. I mean, there are people who can be iron deficient and they're fatigued, their hair is falling out, they can't sleep. That's from iron, not necessarily for perimenopause, right? So there are other things. Thyroid is the great mimicker of everything because you can gain weight, you can not have good bowel movements, you cannot sleep, you can be anxious, like all these things from
Brain
thyroid.
fog.
Brain fog, yeah. So it is a great mimicker of many, many, many things for sure.
Oh, and another big pain point, I'm just going to say for us PCOS women and maybe some other perimenopause women is hair loss.
Mm-hmm. Yep.
Yeah. So what is your strategy with that? Because I'm sure because that is a pain point, no doubt, you know?
Yeah, yeah. So hair loss typically comes in like different categories. So you have sort of the sex hormone problem, like we might have high testosterone or low testosterone. It's kind of a little bit of a Goldilocks hormone. It has to be perfect. You can have thyroid dysfunction. That's another hormone type driven reason for hair loss. You can have inflammation as the cause of hair loss, right? People can get high CRP levels and their hair is falling out from having cortisol that's high. You can have inflammatory, like actually with the products you put on your body that people are reacting to and lose hair. And then you can have issues that are vitamin deficiencies. This is kind of, you a lot of times see these like hair mineral testing things because they're looking
Yes.
for Do you have low protein? Do you have low vitamin D? Do you have low iron? Like all the vitamin deficiencies that can and mineral deficiencies that can potentially be a cause. So I always look for that. Almost always necessitates blood work to see where are you in that spectrum, because you want to know which option is going to work for you, right? If you have too high of testosterone because you're a PCOS patient, we got to lower your testosterone. If you have not enough vitamin D, we got to give you vitamin D. So it's not all just one solution for all of those things. So you really want to do blood work to find that answer.
Yes, just like everything, it's complicated. It can be everything. You know what I mean? It's not, I mean, that's the thing. When I think about just the difference kind of in conventional approaches
Mm-hmm.
to more of an integrative approach, to me, what I see is it being like, one pill to cure something versus really appreciating the complexity of every single condition that we have. And that is, it can be 10 different things or more, right, that can
Yeah.
contribute.
Yeah,
Is
it's a whole body approach. Yeah.
whole body. Does that make sense? And
Mm-hmm.
like mental health, that's, I mean, I'm so grateful. I think people are talking about these things all the time now, much more so than they used to. And how, mental health as an example, if you want to speak to that, just how this can be, it's playing a role in your physical manifestations of things happening, right? Stuff that have happened to us.
Oh, sure. I mean, there's,
Trauma.
yeah, I mean, the brain body connection, it cannot be undervalued, right? I mean, our colleague wrote a wonderful book that just came out called The Biology of Trauma.
Oh yeah, fantastic. I just read it and hope to have her on shortly to speak with her. But
Yes.
she
Yeah.
explains in a way that other people don't. I'm going to just shout out to Amy Appigan, but I don't know if I pronounce her last name appropriately. But the point is how it's like basically you're having a normal response to an abnormal situation, and when you're not allowed to like satisfy the end result, basically, kind of in a traumatic situation, it gets like trapped in your body, something like that.
Yeah. Yeah.
Very simple explanation of a 300-page book. Okay.
Well, and one thing that's beautiful that she wrote in there is that a lot of times genes are sort of the setup, right? So you may be someone, say, prone to thyroid disease from your genes. And
Yes.
trauma like turned them on, right? And this trauma like said, here's the catalyst that turned that particular gene on, and now you've developed hypothyroidism. And I thought that area of her book was amazing, because I think some people want to know, like, well, why me? Like, why did this happen? Why am I going through this? Why does it have to be me? And my sister doesn't have it, and so doesn't have it. And so it's kind of interesting, the concepts of that trauma is just as should be just as valued as, say, having a crappy diet your whole life and then becoming thyroid, or being exposed to environmental toxins and living in a place that turned on those genes that you ended up with diabetes or whatever it is. So there's a lot of different things that contribute, what we call epigenetics, contribute to turning those genes on. And we don't really value trauma as much as we, in medicine, for sure. And I think that's a wonderful that she kind of brings this aspect out to describe that it's not always like just stuff around you. Sometimes it's what happened to you, you know?
Oh yeah, no. I mean, I don't you feel like if you have a woman coming to you with who's getting a divorce or whatever, a single parent and kids, I mean, how can you not think about addressing this aspect of taking care of them?
Mm-hmm.
Because it does play such an important role. Well, so I guess I'm not sure what else do you have to share with someone who might be listening right now that is just tired of feeling like crap with all of these different symptoms, and tell me a little bit, I guess, about your program you have or what you offer, the SHIO program.
Yeah, so I think the most important thing to for this episode is that you don't have to suffer. You don't have to suffer. It may take a couple of doctors to find the right one, that I'll have to say that unfortunately we're still in this era where doctors are not educated about perimenopause, and they're not ready to take care of women with perimenopause and menopause. So it might take a couple of trials to find the right one, but you don't need to suffer and you don't need to feel like you're alone. There are a lot of women that are going through this like you are. And so there are options, whether or not you choose medicine or not medicine or lifestyle or whatever you choose. So just be the advocate for yourself, be the CEO of your healthcare, right? Like be
I
the woman in
that
charge of your healthcare. So I think it's important that women start advocating for themselves and get so many people around them that kind of blow them off and say, it's just part of aging, you're fine. Or your mom might say, I went through it, it was fine. But you don't have to live with those sort of other people's experiences if your experience is one that you need help. It's okay.
I love it, and I think what you say is terrific. That people should think about partnering with a doctor that could partner up with them, and it is challenging. And I often talk about this. That actually the latest research shows that it could take about 17 years for the latest research to become part of like the curriculum and even practice in the
Yeah.
doctor's office. So if someone is saying they're practicing evidence-based medicine, I guess I mean, what does that really mean? Because if the latest evidence says something 15 years, ahead of what's going on there, but I don't want to criticize anyone yet. I think what you're saying, which I'm in agreement with, which what I try to do here and on this podcast is just empower people with the education so they can have an intelligent conversation with their practitioner about some of
Yep.
these topics.
Yep.
Does that make sense? I mean, so you know what I'm talking about. It's hard.
Yeah, yeah. I mean, what I do is not standard of care, right? I talk about nutrition. That's not standard of care. I mean, you get
Yeah,
1 hour of nutrition in medical school. So there are going to be people like me who practice this type of medicine, preventative medicine, proactive medicine, not reactive medicine. So, yeah, if we looked at evidence-based care, I'm outside of that category, right? Because I talk about nutrition, I talk about resistance training, I talk about gut health. None of that is in a medical school textbook, I can tell you that.
right.
So, and it certainly is not in an OB/GYN residency. So I think, Peter Attia said this beautifully he was on 60 Minutes on Sunday.
Oh,
And he
really?
said this beautifully because she asked him, what about the people who are going to criticize you for practicing the type of medicine that you are? And he goes, well, if they were trained in Western medicine, then they don't have the right to criticize me because what I've learned is outside of that. So the people who practice the way I practice, those are my true critics. Like those are the people. And I feel strongly about that because I think you can judge your doctor on those old principles, but that's not the way medicine is going this direction. If we keep practicing reactive medicine, we're all going to be sick. We're all going to have chronic disease. By the time someone's 60, they have 3 or more chronic diseases. That's a
Oh
problem.
my God, I just got a few more years.
That's a problem. Like we're going to break
No,
the
but
system. We
no,
can't
no, but
all these
right.
Medicare patients with these chronic diseases. We're going to break this system. We have to start thinking about proactive medicine, not reactive medicine.
No, thank you. You hit the nail on the head. We don't want to wait to get the diagnosis. And to me, personally, this is where, like, sometimes, like doing the DEXA scan as an example, like 15 years earlier, getting a comprehensive, simple, inexpensive blood chemistry test, we can find out like so many things. We have these great tools. And then simply, I'll just say in my practice, I have an InBody, which I recommend everyone. It's very cheap. It's a body composition test. So it shows if you have actual not just belly fat, but visceral fat, the fat that's around
Yep.
the organs. Like, and then armed with this information, now you're not waiting to get that unfortunate diagnosis
Yep.
or right. That's what it is. So looking towards the future, I mean, what is your biggest dream, hope of where you would like this all to go? Because honestly, you are a trailblazer. I wish you were in my town. I would 100% go to see you because I don't know anyone who practices like you do as a gynecologist, honestly. And I wish there was more. But what is your hope for the future?
My hope is first we got to educate the young doctors coming out to practice proactive medicine, right? I mean, we got to get to the people who are training and say this is the way that medicine should be practiced. I think we have to, that's on the provider side. On the patient side, we need to listen to women. We need to hear what they're saying. We need to stop having a woman come into the ER who feels heart palpitations and be like, you're good. You're just getting old. We got to stop doing that. I don't know why we're so dismissive of women and women's health. I mean, 8% of the NIH budget is women's health. Like, we're 50% of the population. Why are we 8%?
That
So
no, it's terrible.
it's a problem. Like, why is testosterone only for men? Like, we have testosterone. Why do we only get FDA approval for men while 15 Viagra's come down the pike? It's like, dude,
Oh,
like, who are these men having sex with? Like, we need to have more say in the game, and patients have to stand up. Patients have to start saying, I want this type of medicine. I want the right care. I want testosterone. I want that black box of a vaginal estrogen. We have to empower the patients to demand the care they deserve. That's as simple as it is.
no, I agree. It needs to start with the educating of the practitioners because they're the ones that everyone looks up to. I mean, let's be honest. You're pregnant. You're going to listen to what your OBGYN tells you to eat,
Yeah, yeah.
and it's not that great. Okay. So that's wonderful. Well, thank you so much. I think this was really helpful, and hopefully we empowered a few people to ask some questions about their own health and well-being. Look behind the scenes. How's that?
Yeah, I have on my website, I have an Are You in Perimenopause quiz, and I give people at the end of the results, it sort of says, here's a guide to take to your doctor to ask the questions. Like, here's
Ah,
to help them understand a better way to get that conversation going because, they only have 5, 7 minutes in the doctor's office. So they got to have those poignant questions to get there.
that's fantastic. And of course, I'm going to have a link in the show notes for people to download it and send because that's huge because we don't know the questions to ask.
Yeah.
So thank you. That is will be a wonderful resource for everyone. And
Thank you for letting me come on and chat.
terrific. Thank you.